Alrighty, well, thank you for letting us have this opportunity to share our needs assessment and some of the work that I've been doing here at Great River Medical Center in Des Moines County, Iowa. Got a funny limerick. When I first started this work, I thought I would be moving to Des Moines, the city, and I found out quickly that Des Moines County is actually in the southeast corner of the state, and I wouldn't trade it for anything. So what I've done here is put together a 3-year community health needs assessment project. And what it is that every nonprofit health system is required to do this. And so my objectives for today are just to kind of review this process, talk about the results, and highlight some initiatives that really focus on a particular area that I think you all would be interested in. So again, why complete a community health needs assessment? Well, first and foremost, it's a requirement of nonprofit hospitals under the Affordable Care Act. And so what this does for our health system is it helps us get a better understanding of the health concerns that are in our community, to better understand the barriers and issues that people face here. And it also gives us an opportunity to work with the community on some really specific issues, and as well as some projects that we can work together on. And that's been what my work has been over these last 3 years, and this is almost like a synopsis of that opportunity. But in addition to just being a resource for us as a health system, it's a resource for the community. It's a resource for all the organizations and government agencies that work here, that need to apply for grants, that need additional funding, that need that extra support. And so what we've done here is provide a backbone for a lot of the basic community health needs that are happening here, and really diving into some really tough concerns. So to talk about our needs assessment, we had to talk about where we got the data. And so first and foremost, we did stakeholder meetings throughout our community. We did 2 stakeholder meetings specifically, one to really kind of identify areas and opportunities, and one to prioritize them. Then we did a community-wide survey. This survey got over 1,062 responses, which represents about 2.5% of Des Moines County, which is a pretty good polling number. But it's over 2.5 times for what we got in 2016. Now, I always like to remember where you're getting your data, and most of our data came from online, through Facebook, through online email outreaches, sending it to different organizations to send out through their work emails. But we also got paper responses. Over 10% of our responses came by paper, and that's how you really need to make sure to diversify your community outreach, and especially your data collection, because because we think paper maybe not be as useful anymore, 10% of our survey is coming from that information. That's important. And that helps to help a lot of different franchise groups, people that don't have access to the internet, people that don't have access to a computer, so that they can still be involved in helping us to better understand the concerns in our community. We also did interviews and focus groups, and in addition, this kind of helped to galvanize the work that we did with our stakeholder meeting to identify areas of needs, but also discuss possible strategies. Here you can see the organizations that we worked with. The Iowa Department of Public Health was one of them, and that's because we've been dealing with a lot of tough issues related to sexually transmitted diseases and other reproductive health concerns. And so we met with their outreach liaison here to really kind of talk about that particular concern here in Des Moines County. We also worked with Iowa State Extension. Iowa State Extension has an amazing network of organizations throughout Iowa. And if you want to better understand your county, you can always reach out to your extension group. And I think that they are always a resource that you can rely on. You know, our Burlington Fire Department and Police Department are just great people. They represent the largest city here in Des Moines County, and they just have a better understanding of a lot of the acute issues that happen in our communities in regards to falls, in regards to violent crimes or substance use. And so you always want to reach out to those groups if you're having a discussion about health in your community. We wanted to kind of switch it up a little bit, and we talked with the Art Center of Burlington. They're one of the major nonprofits in our area, and you know, not just coming from an arts and community standpoint, but what barriers are nonprofits having when they're trying to get grants or get services or expand services or lose people? And so getting their feedback is always great. Community Action here coordinates our Women, Infants, and Children program, or WIC. And so getting their feedback on the issues of maternal health and children's health here in the community is always important. Our faith-based community is very strong here, and we could have probably talked with a dozen different church groups but one in particular was Harmony Bible, and they coordinate a local youth outreach center here in Burlington called the Maple Leaf Center. And so we thought that they provide a good overview of maybe what the faith-based community is dealing with, but also what our youth are having to face and some tough concerns there as well. Des Moines County Community Services is an organization that provides mental health and disability services throughout the county. And so, again, trying to better understand the health of our community, making sure we touch upon some really unique concerns related to mental health and disabilities. BCSD is Burlington Community School District. They're our local school district representing the largest school here, largest school district in our community here. And so just getting their feedback on the concerns with related education with youth in our community. And so that's just an opportunity that we have to chat with them and to utilize this. The Bridges Out of Poverty program is a unique initiative here, and it's really trying to help individuals with gaining some unique skills and tools to help them get themselves out of poverty. And we wanted to touch base with some of the graduates there, and it was one of the most unique focus groups that I've ever been a part of, and I just loved being able to sit down with them to talk about the concerns they faced over these last few years and just in their lives in general, and to get their feedback on some opportunities that we had moving forward. SERPC, as they're somewhat called locally, is Southeast Iowa Regional Planning Commission. I met with their entire staff actually and just talked about regional concerns as it related to Des Moines County, some really tough issues, and they actually coordinate a development and transportation initiative that really kind of goes hand in hand with our needs assessment. So before I dive into the data from our survey, I wanted to talk a little bit about our community. You can kind of see this slide is just a little bit busy, but what it highlights is a variety of concerns. Number one, it's poverty. If you want to quickly look at Des Moines County compared to the state of Iowa, in almost every group, we have more poverty per population than the state of Iowa does. And one of the scariest things that I see is that 31% of children under 5 live in poverty. That's almost double what we see in the state of Iowa. We also see major discrepancies in male-female poverty rates. Again, both groups are higher than the state average, but the difference is, again, almost double between male and female. So if we're worried about the health of our communities and specifically our children, worrying about the mothers, grandmothers, and other women in our community that do so much work to keep us going is really important. In addition to gender disparities and age disparities, we also have major racial disparities as well. 52% of African American people in our community live in poverty. Again, that is way higher than the state average. Latino communities also is higher than the state average. 2 or more races, higher than state average. So, and even our white community here too, also higher than the state averages. And so what this matters is just that we deal with some tough concerns. Poverty is a huge issue and one that if we want to have a true effect on, we need to work as a community to address. In addition to poverty, we also have an aging community. Almost half of our residents here are over the age of 45, which is a bit higher than the 42% that you see from the state. Our median age is over 4 years higher than the state average at 42.2. And again, our estimates that suggest that about 19% of residents are over the age of 65, which again is higher than the state average at 15.8 or in the US as a whole. Now, why does this matter? Well, as we get older, we do need more healthcare services. We do need a little bit more support. And so these are some major concerns in the long run, if you think of it from a hospital perspective, that we need to be prepared to address an aging population and to have it. But this also highlights a particular issue as well, is that a lot of our younger folks are leaving our community. And that's a strong tax base. That is a revitalizing group. That's a professional group. And so that is something that I've talked with a variety of stakeholders here in our community that they're worried about it. They're worried about the longevity of our communities and the longevity of the people that live here. In addition to age and race, we also are dealing with some difficult issues related to food security. More than half of our kiddos here are eligible for free or reduced lunch, over 10% higher than what we're seeing at the state. For every 1,000 residents here, 184 of them participate in a food assistance program, and that's higher than what we see at the statewide. So we're not only dealing with some racial issues, some age gaps, but we also have some tough food security. Education is also a tough concern. We have about 1 in 5 individuals who have a degree that are 25 or older. Now, that's a lot lower than what we're seeing from the state of Iowa. But again, racial disparities in education come to the forefront. About 85% of Black students, 70% of American Indian, about 76% of Hispanic individuals graduate high school, and that is way lower than the 92.6% that we're seeing in their white peers. And again, massive disparities as it relates to college education. 6.5% who are Black who have a bachelor's degree, 12.4% with Hispanics, compared to 1 in 5 for white. So again, just seeing these disparities is really important, but talking about them, making them be known, working with your school districts, working with local community colleges to address these concerns. So if you're talking about education, race, gender, and age, these are all major concerns. But what are these? Well, these are what we call the social determinants of health. And social determinants of health are reliant on community volunteerism. And when this is from our community survey, about 40% of individuals who answer the survey don't volunteer at all. And why volunteering matters is that it helps us address some really tough concerns. There's a variety of great people that do great things. And so we have an opportunity here to address this concern as it relates to the social determinants of health. And so those social determinants of health, not having social networks, having difficult working conditions, maybe not having the right health services or education or income, these are those determinants of health that are majorly affecting our community. And if you think about not having the volunteer base to address those concerns and to support them in a variety of ways, that makes it a long-term issue. So when we're talking about our community, we're talking about our community's health, understanding these contexts can be very powerful. So I'll dive into the survey data now, and about 64% of people highlighted that access to healthcare is the #1 community health factor. And as a health system, we believe that we can affect that change. There are a variety of other concerns, including good jobs and a healthy economy, health behaviors, low crime, affordable housing. Each of these in some way, shape, or form addresses our community's health. And you can kind of see here in the data how the community highlights them. And it's not to say that emergency preparedness or arts and culture aren't important, but these are what our survey respondents highlighted as the most important community health factors. So again, this is kind of that same slide, just a little bit more in a prettier view. So again, if we're thinking about opportunities to address concerns from a healthcare perspective, access to healthcare makes a lot of sense. So with community health problems, there are a variety of concerns that are highlighted, but mental health, substance use, obesity, and poverty were all highlighted in the top 4 here. And those are 4 that not only have been on our previous needs assessment, but are on something that we just care about both internally and externally as it relates to our hospital system. So we want to make sure that we have opportunities to address each of these concerns in a variety of ways. So if we think about mental health and substance use, we want to kind of combine those together in some ways to make that an area of opportunity. Obesity directly relates to diabetes in a lot of ways. So we see those being connected in some ways. And again, as I mentioned before with poverty, with being a major concern, we as a health system need to be worried about that as well, because we offer a variety of support services, a variety of great programs and just ways to get people the right insurance at the right time. So having an opportunity to address poverty is very important. As kind of previously highlighted, each of these top 5 interrelates in some way to what was highlighted in the community health problems. Substance use and obesity were highlighted previously. Poor eating habits kind of directly relates to obesity and diabetes. Alcohol abuse. Among all the drugs and tough issues that our community faces, alcohol continues to be the #1 issue that our ADS group, the Alcohol, Drug, and Dependency Services group, sees. And so let's not swipe this under the table and forget about it. Alcohol abuse is a tough concern, and especially in a rural community where people are reliant on traveling on county highways and county roads, alcohol abuse can be a major concern and something that can lead to early death. And again, lack of exercise directly relates to obesity in some way, shape, or form. So if you think about what our community can handle and what our health system can work on, substance use was previously highlighted, so was obesity, and so was alcohol abuse. So we see those being opportunities moving forward. In addition to the data itself in regards to health problems, we also kind of dived into 3 different unique questions. About 85% of our survey respondents said they had a personal doctor or nurse. And I want to flip that around. 15% of our population feels that they don't have a personal doctor or nurse. 1 in 10 people don't feel that they have someone they can talk to, that they can communicate with, that they can rely on. And that's something that we as a healthcare system have an opportunity to address. This data here, how many times have you visited the doctor, quick care, emergency room, or been admitted to the hospital? That gives us some good feedback on if our population needs to work with. And if we're thinking about data mining and looking at unique concerns, we can specifically take out all of the individuals that say had 2 or 3 emergency room visits in the year, and then look at that data set specifically to see what issues we're seeing in those patients. Are they saying that mental health and substance abuse are the primary concern? Are they saying that poverty is the thing that they're most worried about? Well, that gives us an opportunity internally to kind of look to see where we can address particular concerns. We also ask a question related to what barriers of care people are facing. And it's not surprising, but I looked through about 744 responses. 200 of them highlighted cost as the number one concern that they're worried about. And that shouldn't be surprised. In our day and age, cost is such a huge driver of healthcare and healthcare services. So we as a healthcare system have an opportunity. But it's good to see access up there too, so to know that we are choosing the right opportunity to move forward. These are some comments that were made, and so I'll only go through the first one, but it kind of highlights that cost issue. The fear of costs. My wife had a headache, and we went to the ER room last year. The doctor thought she was having a stroke, flew her to Iowa City. They said she had a migraine, and the costs were over $70,000 without insurance, and they sent her home 24 hours later. That kind of highlights a variety of concerns. Well, number one, internally at Great River, we wanted to look at this particular story to make sure that we don't have any tough issues related to this, and we're not sending individuals through an expensive med flight to take care of what was probably a pretty simple concern. But it also highlights the difficulty of cost, that if this individual, I'm hoping this individual had a health insurance, they didn't say so. But if they didn't, then this could be debilitating. This could be backbreaking. This could end their daily lives in a lot of ways. And so we as a community have an opportunity to better understand. The last 2 quotes really talk about a lack of child psychiatry here, and that family structure can be so important in helping people address long-term health concerns, especially their barriers to care. So as our My Health system moves forward, these are the 4 concerns that we feel very comfortable with. Obesity and diabetes, poverty, mental health and substance use, and access to healthcare. And these kind of interrelate really significantly with what we saw in 2016. Again, our healthcare system is required to do this every 3 years. And so violent crime was highlighted in 2016. And we recently had, at that time, there was a 16-year-old who had been gunned down in the streets. And I think that hits home with a lot of communities here, especially here in a rural community where we're very close and very connected. And so when we see violent crime being highlighted, we know that that's an opportunity to improve. But it's not to say that violent crime isn't a problem anymore, but as a health system, we feel very comfortable in addressing access to healthcare, and we see that being an opportunity moving forward. So I talked a lot about those different initiatives, and I just kind of wanted to talk about one specifically. We reached out to a cohort of patients here based on utilization. And you can kind of see here in figure 1, it's a cohort utilization by type. And so you see day hospital, emergency room visits, inpatient, outpatient visits. And this is between 2016 and 2018. And you can, as you see it, you can maybe dive down specifically into certain data points like 136 emergency room visits for this group of 12 patients. But it's increased significantly over those 3 years. And then when you compare it to the costs, that we had over $1 million in costs in these 12 patients alone in fiscal year 2018. So when you're talking about utilization and you're talking about access to healthcare, working with a subset of patients can be really powerful, and where data can help improve your understanding of it. So when we want to try to address emergency room visits and we see a long-term opportunity to address these high-cost centers, this is the type of data analysis that you need to do, the type of work that you need to dive into to look and to see how many of our patients are dealing with 5 or more emergency room visits. Again, pulling back that needs assessment survey to see how you can merge different data sets together to address a really long-term concern. And so what I see here is an opportunity moving forward to really understand where our utilization is coming from, where our costs are coming from, and how we can help better support patients that may be using the emergency room, maybe as a primary care center, maybe it's the only place open for them when they get off of work and they have nowhere else to go. How do we educate them? How do we work together? How do we expand our services to support them? These are really tough answers where we need data to support those decision makings. And when we talk about those patients, we talk about an integrated approach to their care. We need people that know exactly what's going on. They need to be mobile ready. They need to have different apps and services that might be ready for them. Maybe they can't afford it, and maybe that's something we can help with. Or maybe we have a great group of people that can help address their concerns. And us working together is so important. And we, in my last grant that I've been working on, we care so much about this idea of care coordination and working together and addressing those social determinants of health so that we can bend the cost curve of our healthcare system. So I know you might not be able to send me questions or comments directly right now, but again, I'd appreciate any thoughts that you'd have, any opportunities you see us moving forward. And as you kind of decide the different projects and initiatives that you might be working on, understand that data is always going to be involved in some way, be it the survey qualitative information that we get or the down and dirty quantitative information related to cost and utilization. And so I just want to thank you all for this opportunity and some things that really we see here moving forward at Great River Medical Center.